All right, our third patient, Asian, obviously, and there are differences. I think it's important to discuss the differences in ethnicities and how surgery is done. I do think that in Asians, the skin thickness plays a factor in results. I think the anatomy is often quite different between Asian and Caucasian. Bone structure is drastically different as well. All those play into how to do the surgery, actually. So my Asian eyelids and how we do that surgery is drastically different in Asians than Caucasians, but the techniques used for both are very important because they play against each other, and we're able to incorporate different things by what we do for Asians for Caucasians and vice versa. So hopefully that wasn't too confusing. But in this nice patient, she has a heaviness of skin that Asians tend to have, but Asians will really age well until really about late 50s and 60s. And then there's a dramatic loss of elasticity. And that happens in other ethnicities and races, but there's a more of a dramatic effect in Asians, I think. And some of that is related to the skin heaviness. So in this woman, again, focus on the laugh lines, the marionette lines, the jowling, the jawline itself, and then the neck contour. The picture here is, I believe she's 6 months out from surgery. She did have a deep subsmass or extended subsmass facelift approach, which we call a deep plane facelift as well. She's had fat grafting to her face. She's had a lot of neck work, actually. Her surgery focused a lot on the neck and to try to reposition some of the lax muscles, the platysmal muscle. And again, we're going to embark on stage 2 for her, which is her eyes, but we focused on the lower face and the neck. So again, if this procedure is done well, it should not be visible to anybody. The incisions, any telltale signs of a facelift, like earlobe being pulled down, scarring, dimpling, irregularities to the face. We want smoothness and definition. And so some people in social media would call a snatched look. So that is what we're trying to do in some patients. And in this case, she wanted that.